though women control 80% of healthcare dollars, 50% of women distrust the healthcare system because of experiences like mine. This distrust comes from these negative experiences where doctors are dismissing patient symptoms, where there's a lack of empathy, discrimination, or poor communication. Thank you so much, Jamie. I'm so excited to share about Lasa Health. We are an end-to-end patient engagement platform that turns patients into partners. And this is based on my own experiences. So for a decade, I experienced debilitating chronic pelvic pain. I visited 25 doctors looking for answers, bouncing between specialists and in and out of the ER, but I was told again and again that I was fine. Over the years, my symptoms got worse and I found myself frustrated. How could I get better when no one even believed that I was sick? So I decided to take things into my own hands. I spent months researching, found a specialist, and was finally diagnosed with endometriosis and celiac disease, two very common causes of chronic pelvic pain. Now, unfortunately, my experience is not unique. Even though women control 80% of healthcare dollars, 50% of women distrust the healthcare system because of experiences like mine. This distrust comes from these negative experiences where doctors are dismissing patient symptoms, where there's a lack of empathy, discrimination, or poor communication. And these experiences ultimately hurt clinics' bottom line due to diagnostic delays, canceled procedures, and damaged reputation. So Lasa Health steps in to help. Our end-to-end patient engagement platform optimizes how women interact with the healthcare system, allowing any clinic to adopt a new standard of care for women. Before the appointment, patients are sent a link to our proprietary intake system that empathetically collects information about the patient's concerns and uses machine learning to screen them for undiagnosed conditions. Then during the appointment, physicians have a clinical decision support system that provides personalized recommendations to support with diagnostic decisions and patient communication. After the appointment, we continue to support patients through a generative AI chatbot that provides support, evidence-based education, and monitors the effectiveness of the treatment plan. We deliver value to clinics through three pillars: patient success, efficiency, and quality improvement. First, we improve the patient journey and reduce these negative experiences. This increases revenue, increases referrals, and results in a higher net promoter score. Second, we reduce the patient intake time and provide tools to upskill staff to care for complex patients that would have been referred elsewhere. This increases utilization, reduces burnout, and increases profits. And lastly, we reduce the time to diagnosis by proactively screening patients for overlooked conditions and improving the patient outcomes. This also increases reputation and enables value-based care. We have validated our program with over 100 patients and providers to build a solution that both delights patients and integrates seamlessly into clinical workflows. Kimitha Redman, a nurse practitioner from Maryland, is one of the many providers excited to implement our solution. She says, Lasa Health's platform would improve the patient-provider communication, increase empathy, and make appointments more efficient. I'm advocating for this at my clinic. My co-founder and I have deep experience in healthcare technology and innovation at multiple startups, and we are supported by an amazing team of advisors. We have participated in Texas Tech University and Springboard Digital Health's Innovation Accelerator programs. We've already released the patient-facing side of our platform and are continuing to validate and refine the user experience. We've raised over $300,000 in non-dilutive funding, including an SBIR grant from the National Science Foundation. And now we're preparing to launch our full solution into clinical sites. If you're a clinic or health system, we would love to chat with you about how you can help turn your patients into partners. Here is my contact information. Feel free to reach out. Thank you so much.
Great presentation. And clearly, there's a whole new vanguard of founders in femtech that are really trying to drive change. We have many of you on this call today. When we take a look at Lasa in particular, how does this integrate into clinical workflows? How are you thinking about making sure that that provider at the point of care has a great experience?
Yeah, that's a great question. So first, our platform is EHR agnostic, so it can be easily integrated with any provider, regardless of their EHR. And the second is the bulk of the work is done by the patients before the appointment. So there's no additional clicks in the EHR or additional time spent in the appointment to screen these patients. That's all done before the appointment by the patient, ultimately saving the provider significant time in each appointment.
And given the rise of interest in your space, how are you really looking to differentiate versus other competitors?
Yeah, great question. Our bread and butter is really focusing on these care pathways for women. Initially, we're focused on gynecology clinics and chronic pelvic pain pathways. We really target these conditions where you see long delays in diagnostic. So the average time to diagnosis in chronic pelvic pain is 10 years. So there's a huge opportunity to exponentially improve the patient experience.
And when we talk about that patient experience in particular, sometimes people are uncomfortable talking about these types of diagnoses. What are you doing as Lasa to reduce the stigma or make people more comfortable to actually have these very important discussions and get the care that they need?
That's exactly. So a lot of the problem is it can take years before a patient might even bring up the concern to their provider when it is a stigmatized condition. But what we've seen is patients have a higher likelihood of discussing this before the appointment with a chatbot and discreetly sharing that information versus doing it in person with the provider. Oftentimes in that moment, your 10-minute appointment, you might have been waiting months and months for this appointment. It can be really stressful. So we give patients time beforehand to help them shape their story, help them figure out how to best articulate what's going on. And that really facilitates the communication between patients and providers.
Margaret, we have a question from the crowd. What is the Lasa business model? And is there any IP, intellectual property, as part of your tech stack or how you do business?
Yeah, great question. Our business model is a B2B SaaS model. We sell directly to clinics and health system. And then our intellectual property lies in our tech stack, our machine learning and AI models. That's where our intellectual property lies. Thanks for the question.